February is Heart Health Month, and joining us today is Dr. DeLaRosa from Portneuf Medical Center. Thank you so much for joining us today. Tell us, what are the top three, I guess you'd say, conditions for a non-healthy heart?
Well, first of all, a non-healthy heart, people get short of breath. They can't walk anymore. All of a sudden, they feel they just can't do what they used to be able to do. And it's very difficult to just move around. That's the first sign of anything when somebody has a bad heart.
Okay, and what are some of the other things that maybe signs we can see in our daily lives that our heart might be not as healthy, and then what can we do to help have a healthy heart?
So when the signs you start seeing is all of a sudden you can't do the things you used to be able to do. I used to be able to walk, I used to be able to run, I used to be able to play with my kids, grandkids, and all of a sudden I can't do that anymore. And now I find myself just difficulty with breathing and getting around anymore. I think it's just it's old age, or I'm getting older, but it's actually your heart talking to you.
Can't run a 440 anymore, can't do those sprints.
Can't even run 100 anymore, but still, yeah.
So if we want to get our heart healthier, what are some things that we can do to help do that?
I think the first thing is that everyone should be seeing their doctor. Everyone should have a primary care doctor and be able to get checked out, get your labs checked out, get a baseline of where you are. You'd be surprised sometimes, and things that you could fix. So that's number one. Number two then is weight. Weight is a big deal. Is watch your weight. Know where your weight's supposed to be. All of a sudden, again, talk to an expert to be able to help you get to the right place where you have to be.
Can your general practice physician set you up with a plan like, here are some exercises you can do, don't bite off more than you can chew, but here's some things that you can do to help get your heart healthy? Absolutely.
That's what a primary care doctor is supposed to do. It's supposed to be there to prevent. And as we get older, we will get sick, and you have to get preventative medicine, preventative care. So see your doctor. Your doctor will be able to help you and outline a great plan for you.
And you've been in practice for a couple of years. What are some of the exciting technologies that you've seen come through in the past few years?
Were you trying to call me old? Is that what you're trying to say?
I said you've been in practice.
Yeah. No, I have been here for a long time. And some of the things that I've seen is, again, is to set a program for yourself. Set goals. We all set goals in the new year and then we fail. But it's about restarting again and trying to set something. And it doesn't have to be big, like losing 30 pounds, but I'm going to lose 5 pounds. And I'm going to work to that goal. And that's what you need to do.
And to help out people, you've got an instructional course coming up this Thursday. Tell us quickly about that.
We do. It's actually February 22nd.
Okay.
It's a day before my birthday, so I know where it is. So it's that Thursday, February 22nd, and we're going to have some great speakers with us. We're going to have Dr. Warren Willey that's going to be speaking to us, Dr. Ben Call, and myself, that we're going to be able to speak to the community about heart health.
Okay, and if you'd like more information, you can go to the Facebook page, Healthy City USA, and we'll see you out there later this month. And
awesome, Matt.
In advance of that, happy birthday.
Thank you very much.
Thanks.